Diane Stewart, the Director of the California Quality Collaborative. CQC is a healthcare improvement organization dedicated to advancing the quality and efficiency of patient care here in California. One of the programs that we offer is the Chronic Care Collaborative. We work with 5 physician organizations in inland California caring for 250,000 patients and help them build systems to take better care of their patients with diabetes and heart disease. You're about to hear from one of those physician organizations about how participating in CQC helped them improve care for their patients.
We've been giving really strong consideration to doing diabetes management and other disease management for a number of years, and had entertained a variety of interventions. We were actually starting our own diabetes clinic, which had its set of problems, and was limited in the scope as far as the number of patients that it could really address. Concurrently, actually, Dr. Payton joined us, and we thought about this together and thought that the CQC would offer us a much broader perspective about how to really implement change in disease management. And the more we looked into it, the more it seemed like it addressed our needs. So the CQC gave us a structure to address diabetes management across the entire organization. That's why we started. And it grew. The more we participated, the more we got enthusiastic and expanded the scope of our project.
The CQC actually gave us that direction that we really needed. It's something, again, we wanted to do for a long time, and it provided the focus and kept us on task.
And I would say keeping us on task is a big part of the whole process.
Absolutely. We were a little skeptical at first that our physicians weren't going to have the buy-in and the passion that we had about the project, but he really changed their mind, and anyone that maybe was a little skeptical, he changed their mind. And honestly, we had great support at the physician level, and I think primarily responsible is Dr. O'Nanian for just the relationship he has with the physicians.
Well, thank you for that, although I was probably more skeptical than you going into this. But frankly, the doctors were easy to deal with once you presented them with the facts. And if you really believe yourself, it's easy to make others believe, and that was what was infectious about this whole process. The one thing I can honestly say is you can't underestimate the value of face-to-face meeting with everybody involved in this electronic era where almost everything we're doing is by email, Facebook, and everything else electronic. It's much more effective to have face-to-face encounters.
And what we did is we rolled this out site by site. And again, we had face-to-face meetings with all of the people involved in the project, and to get their buy-in and their support and their feedback. And it also created ownership at the site level. And what they did is we had gap reports run on people that were either missing their labs or were outside of acceptable ranges. And these clinical staff would call these patients and have them come in, mail them the lab rec, have them run their labs, and then set up a follow-up appointment with their physician. And we're starting to see success across the board at every site that we're implementing it at. And we're running reports every month. We're sending them out to each of our sites, and each site's improving every single month. And so it's nice to see our labor, the fruits of our labor being, seeing our success for sure. As we look at our reports on a monthly basis, we're seeing our scores increase. More patients are being screened. More patients are becoming in control each quarter. And so we're seeing success certainly across the board as we roll this out at different sites. So it's nice to see that happening. And we're excited to see if we meet our goal towards the end of the year. And we're certainly close now. So.
We're doing this during a time of duress in that all of our doctors are in the middle of an EMR install. So although they are not anxious to take on new tasks, they have been willing to do it. It's been important for us to try to do as much of the clerical work as we possibly can for them so that they're really doing what requires a physician's expertise to do. So if we take that into consideration, they've really come along very nicely. And the other thing I think is important that we've learned by doing is to be flexible in our approach.
Absolutely.
Some doctors want to be in control, so if they tweak it a little bit and it works for them, that should be just fine if it gets results. And we're certainly allowing that. That's gaining us a lot more acceptance in this whole process.
When they feel they've contributed to the process, they have more buy-in, they're more accepting of it, and they feel they own it more. And each site is doing it a little differently, and it's all working independently of each other, and we're seeing results at each site. And that's the ultimate goal.
The other thing is we looked at this as a template for process improvement. So if we can make this work with the items we've chosen to act on, we now have a process and a team that can apply the same methodology going forward, and that was very important to us.
I think without the CQC, without the structure and the focus, I'm not sure we would be where we're at today. We had the desire and the passion, and we just needed that outside effort and focus, and the CQC provided us with that.
If you are interested in finding out more about how to participate in a CQC program, please visit our website, www.calquality.org. Thank you.